If you're diabetic and you like fizzy drinks, well then you probably had people say to you, oh, just switch to the diet stuff, you'll be fine. Well, in this video, I'm going to try and answer if that's actually true. Stay tuned. So I'm going to cover three things. Number one, what is it that full sugar fizzy drinks actually do to your blood sugar? Number two, what happens if you switch to the diet version? And number three, are the diet versions any better for diabetics? That's the big one. I'll also cover three reasons why they're probably not. Now, before I go any further, I'd like to just cover a personal story about Coke Zero addiction, which I had for a very long time. And the primary reason for covering that story today is going to take my mind off this hill that I'm running up. But secondly, it might give you a bit of hope that it is possible to come off these drinks. So what happened? Well, a few years ago, I was on my wellness journey, and about the last vice I had was Coke Zero. And I was drinking about 2 litres of that stuff a day. And one night, when my wife was away, embarrassingly, she was away running the Paris Marathon, and I was at home for a few nights with the kids, and I put them off to bed, and I'd arranged a play date on the Xbox, which I don't really do now, but anyway, with some old uni friends, and I had my snacks, and I had my Coke Zero, but there was only this much left in the bottle, and I thought, that's okay, I've got another bottle in the utility room. And I went to check. No, I did not. Now, that really upset me to the point where I started panicking that I wouldn't have enough. So I thought, well, the kids are asleep. I could just go down to Tesco and quickly get a bottle of that to bring back up to the house. Other supermarkets are available. And it was in that moment I realised this is how an addict behaves. This is how someone who's addicted to things like alcohol or heroin would behave. Their need for that substance far outweighs their sensibility and their responsibilities towards things like their kids. And to be clear, my kids at the time were 10 and 5, I think. And that's really bad. So it was a eureka moment. I left the bottle in the fridge. I didn't drink any of it. I left it there for a week. And after the worst headaches, oh my goodness, the worst headaches, eventually those went away. And I poured that bottle down the sink. And I have never, ever, ever gone near fizzy soft drinks ever again. It was terrible. But as I said, I was drinking 2 litres of that a day. It can't have been good for me. So in this video, I'm going to explain the reasons why that's not good for you, and in particular, why it's not good for diabetics either in the long run. Okay, let's get on with it. Now, before I go any further, I want to just say there are only 3 healthy drinks in the world. Number 1 is water. Number 2 is tea. And number 3 is ground coffee. Anything else is form over function, taste over health. So if in doubt, drink those 3 things, leave the rest. And even those come with some caveats of not to drink too much of them and just have the Goldilocks amount. Full sugared fizzy drinks, Coca-Cola, Pepsi, Iron Brew, if you're from Scotland, things like that. Those are categorically bad for you. They contain lots of ingredients that your body doesn't know what it is. And in terms of the sugar, the average can of Coca-Cola contains 9 teaspoons of sugar. The average can of Pepsi is about 10. And Iron Brew, well, it's only 3 nowadays, but it used to be the same. But in 2018, they changed the recipe to include sweeteners as well, so they can claim it's a little bit less sugar. It's still more than you would eat at the dining table. You wouldn't exactly, 9 spoons of sugar helps the medicine go down. No, you wouldn't eat that. So those drinks are extraordinarily high in refined sugar, which is very, very bad for us. The reason it's bad is because it goes into your bloodstream way faster than almost anything found in nature. and your pancreas has to deal with huge amounts of sugar going into the bloodstream. That means it needs to squirt out a load of insulin to match that. And over time, if you're doing it regularly, then it gets tired. And amongst other things, which you can watch in other videos, it pushes you towards metabolic syndrome, type 2 diabetes, pre-diabetes, things like that. So it's a little bit like walking under falling trees. Eventually one of them's going to hit you. So stay away from those drinks. Full stop. There's no positives at all, perhaps other than taste. But as I said, taste and health, they don't usually go hand in hand. So let's talk about these zero drinks. Are they really the hero that they claim to be? Are they really better for you? Do they actually help your blood sugar? Or are they messing up your metabolism in the background? Corny line imminent. Let's pop the lid on fizzy diet drinks. Oh geez, that's such a bad line. Oh well. So in the short term, diet drinks do have a benefit. They have no calories, they have no sugar, and therefore they don't spike your glucose the way that sugar drinks do. And as a result, they also don't spike your insulin, which means they can certainly cause a flatter sugar profile in your blood. And that's very helpful if you're a diabetic. But that's not really the whole story, because while you're improving your health today and your blood sugar today, you might not be improving it further down the line. Some studies have actually shown that people who drink more diet drinks than their full sugar counterpart are actually at higher risk of developing things like type 2 diabetes. They're also, weirdly, at risk of more cardiovascular problems, like heart issues. And on top of that, there's some evidence to link fatty liver, which is where your liver's full of stored fat and doesn't function properly. People drinking those kind of drinks are actually more at risk of fatty liver disease. However, there isn't a causal link that's been demonstrated yet, which means it's not definite. And there's a little bit of chicken and the egg happening here, because we don't really know if people who are overweight and prone to type 2 diabetes are also the same people who are more likely to drink those drinks. So we can't really tell. And the actual answer is probably somewhere in the middle. So while the short-term evidence is that blood sugar might not rise as rapidly as if you're drinking the full sugar version, you kind of have to think of these drinks as like Coca-Cola's not so bad cousin. Like, you never invite Coca-Cola to the barbecue. Occasionally you'll invite the less bad cousin, but they're also pretty awful. So maybe you have them over once a month, but not every day. Now, how exactly are those zero-calorie drinks causing problems? Well, as I said at the start, I'm going to give you 3 things that they do that cause issues with your body. The first one is sort of common sense. When you drink something that's sweet or eat something that's sweet, your brain says, that's good, it's sweet, let's get more of it. And so you try and consume more of that particular thing, because your body and your brain aren't that evolved. They're the same as they were 10,000 years ago, and sweet things are very scarce. Think of things like honey and berries, but not much of them around. So when you get them, the dopamine sensor in your brain, or the part of the brain that's releasing dopamine, says, this is brilliant, you got to remember this, have more of it. And as a result of that, you don't really get that sugar fix, because it's not sugar, it's sweetener. And sweeteners per gram are about 50 times sweeter than normal table sugar. And that really confuses things. So the average person who drinks Diet Coke versus full-fat Coke drinkers will consume between 200 and 400 extra calories per week because of snacking. They'll often go looking for the fix, the sugar intake that wasn't there with the drink. And because of that, they consume extra food or extra drinks which contain sugars. And that pushes their total calorie intake for the week much higher than it would have been if they just had the Coke with the sugar in it in the first place. I'm not advocating that they should drink that. I'm just pointing out that in this particular situation, the brain and the body are a little bit confused. And as a result of that, which I seem to say all the time, a result of that, you're going to end up eating and drinking more calories. So that's one reason to stay away from them. The second reason is that your gut is filled with about 100 trillion bacteria, fungi, viruses, and that's known as your gut microbiome. And your gut microbiome is very sensitive to what you put in the body, and they do not like sweeteners. They don't like the things found in those 0-calorie drinks, and it confuses them. And what ends up happening is you may get a change in your gut microbiome quality, and some of the bugs that were helping to manage your blood sugar don't work that well, and other bugs appear which are not as good at handling blood sugars, and their interaction with the gut wall then again causes a problem with the body, because the body cannot metabolize its sugar as well. And there's a theory that that might actually push you towards a bit more of a diabetic propensity. Good word. Yeah, push you towards pre-diabetes and diabetes itself. So gut microbiome in at number 2. And in number 3, which I think I mentioned earlier, those chemicals, they got to be metabolized somewhere, and the place they're metabolized is the liver. The liver deals with poisons in your bloodstream, and a lot of these things, while they say they are safe, doesn't mean they're healthy, and that requires the liver to metabolize those. It's quite hard work on the liver. It also ends up becoming fatty as a result of these processes and having to work overly hard. And there's some evidence to support a link between fatty liver disease and drinking diet drinks. So that's reason number 3, is it might promote a fatty liver. So while the marketing and your best friend might promote diet drinks as something that's good for you in place of the full fat version, there's no doubt about it, they're definitely not healthy, and they might make your body a little bit grumpy. So perhaps think before you have that next can whether or not it's actually a health food or whether it's just a wolf in sheep's clothing. Now, in terms of high quality studies, and by that I'm talking about studies that have been performed with meticulous and rigorous guidance and safeguards to make sure the data is correct, well, there are some studies out there, and they do show that diabetics who drink diet drinks are likely to have a little bit of weight loss and a little bit of flattening of their blood sugars, which sounds great. Unfortunately, none of those studies last longer than a few weeks or a few months. And the fact is, we just don't know. We don't know what happens to people who drink these drinks on a regular basis for 5 to 10 years. There's certainly evidence out there that's, I suppose, anecdotal or low quality, but there's no good long-term strong evidence to say stay off these for good. But that's most certainly not a green light. That's an amber light. Maybe now and again, maybe special occasions, but definitely not every day like I was doing. So, what is my advice? What are my 3 top tips as a doctor that I would say to a patient that asks me the question, should I change from full fat Coke to Coke Zero or Diet Coke or something like that? First one is, think of this as a nicotine patch. This is something that you might want to have in the interim while you're coming off fizzy soft drinks altogether. You wouldn't wear a nicotine patch for the rest of your life, so think of them that way. You're just using them to get away from the high sugar quantities that are in those full sugar drinks, and in the end you're going to wean yourself off of that too, and that will hopefully in the long term help you in terms of your general health. Number 2 is, in the short term, they will flatten out your blood sugar spikes, and that could be advantageous, but only if you consider that it's not the whole story and that you do need to think about your carbohydrate load, your glycemic index of the foods you're eating, your exercise, your sleep, and all of those other good things that diabetics could possibly be neglecting. So it's not the whole story, but it will reduce your blood sugar, at least in the short term. And number 3, you don't need to never ever have them again. If you're out for a meal, or if you're at a party or something, you know, feel free to have 1 or 2. And life's pretty boring if you just do all the good stuff and have none of the luxury and none of the treats. But think of them as that. Think of them as a treat. However, if you're like me and you're really addicted, stay away from them. You are never ever going to stop drinking them if you allow yourself to have them now and again. Before you know it, that'll be every day. So now and again is a treat if you can handle it. And here's a little bonus one for you. What I did was I bought a soda stream and I just have fizzy tap water every day because it's healthy, it's not Coke Zero, but also it saves on plastic. You don't use any plastic other than the bottles that come with the machine, and they last for about 5 years. So get yourself a soda stream or some generic version of that. So there you go. To sum up, fizzy diet drinks are not all they're cracked up to be, but they're possibly a better option than the full fat versions. But remember, real drinks, real food, real health. Those are not real drinks, and they are designed for taste so that you'll have more of them. I'm Dr. Zain, and that is Diet Drinks for Diabetics explained, I hope. Please leave a comment and also like and subscribe if you would. That helps the channel, and I'll see you in the next video.